for someone who's listening right now who plans their day around the bathroom, or who's going just in case or worrying they won't make it in time, what do you want them to hear from you?
I want them to hear that there's help out there, that we would love to help you, and you don't have to live like that. You don't. When you start eliminating your social engagements and, the way you're living your life, you're losing time. And we can give that back to you, no matter what age. You're not too old for any of these therapies that we have here.
Would you rather have a patient come to you with no medications, or having already tried medications? What would you, if you had your dream, right? Because patients go through, family practice, GYN, where would you like them to start?
I would like to have had them try a medication and it not work, so that I can cross that off my list. My biggest trouble to get people to more advanced therapies is that most insurance make them try one, oftentimes two or more medications. So if they've already had that trial, I can then move on forward and give them other options that are clearly going to work. Medications work. Some people, I would say on average, between 75 and 85% of the time. So it's not 100%. And there's limitations to medications as far as, women over age 65 really shouldn't be on anticholinergic medications. And that's the one everybody gives first because it's usually the one that's covered. So there's probably 13 in that group. And the reason why we don't like to do it is because as we age, our liver and our kidneys don't work as well. And so you're more likely to have side effects. It also, this group of medication is anticholinergic medication. So therefore, those medications that we're giving are anticholinergic medications. The patients start to lose their cholinergic receptors in their brain. So therefore, they're going to have more fogginess, forgetfulness, and, it becomes a problem. And
that is the last thing anyone
right.
wants as they get older.
Right. So there is one that I would still consider that it doesn't cross the blood-brain barrier. And so it's there if I really can't, because the cost of the new group, which is the beta-3 agonist, there's getting more coverage now, especially with Medicare. But sometimes if they haven't tried anything else, Medicare is even giving us a little bit of a fight. So then I only have the one medication that I would give that doesn't cross the blood-brain barrier to try. But the anticholinergic medications have more side effects. So they cause dry mouth, they cause dry skin, constipation, those kind of side effects that are unpleasant. And a lot of times as we get older, our bowels are not as regular as maybe they were when they were younger. And a lot of people, because of other health issues and medications, are having constipation. So I don't want to give them something that's going to make their constipation worse. But the beta-3 agonists, they're newer ones, they're very safe for women over age 65. They don't have any kind of cognitive changes that occur. They have less, or I don't really get many complaints of patients that take the beta-3 agonists that have constipation or dry mouth or things like that. But they have their own group of side effects that are possible. So, we kind of weigh it, and I give people a trial because all bladder medications take a minimum of 6 weeks to really notice any kind of side effects. So now they're waiting another 6 weeks to see how they're doing. So if they came in, they already tried meds, then I don't have to make it.
So let's break it down for these ladies. What are they trying to treat? They're trying to treat that urge, that running to the bathroom.
The urge, getting up at night, the frequency of urination, and the leakage. So it could be one of those symptoms or all of those symptoms or a combination of those symptoms.
And for the older class of drugs, what are those brand names that people are familiar with.
The brand names that people are familiar with are oxybutynin, Toviaz, Vesicare, Centura, Trespian.
And those are the older ones
Those are the
that
older ones.
usually are covered by insurance. They're generic.
Mhm.
So sometimes you have to use those for 6 weeks, and then you can get into the beta 3 agonists, which
Yeah.
are the newer class of drugs. What are some of the names that people might be familiar with?
Myrbetriq, and they've gone generic, and their generic counterpart is mirabegron, and then the other one is Gemtesa. So those are the only 3 in that group. Gemtesa is the newest one. I would say Medicare covers usually the Myrbetriqs and not the generic, but we don't. It's always hit or miss. Sometimes some of the Medicare companies have already upgraded, so they're ready to take on the generic, and others haven't got the memo yet, even though it's gone generic for several years now. No. Prior authorization is a lot of this, to get the meds covered. And typically I write, like, I have a coin letter and I just fill in all the blanks for what my patient has already tried, both behavioral wise, if they've gone to physical therapy, what medications they've tried and failed, or reasons why they can't take it. So any of the anticholinergic medications, if you have narrow angle or closed angle glaucoma, you can't be on these medications because it could make it worse. So I need to make sure that the patient doesn't have these before I would even suggest that kind of medication. So the question I always get, well, I'm 60. The answer is that it is worth a try. Typically, we don't have as many side effects under that age, but some people do. And so sometimes that's the only one their insurance will cover because they're like, well, I can't use the age excuse.